Hello, my name is Eamonn Strathie. Today I'll be talking about Jacob, who was recently diagnosed with cystic fibrosis. This presentation will explore the pathophysiology of cystic fibrosis and CTFR modulators as a form of pharmacological intervention. Cystic fibrosis is a genetic illness that results in deposits of thick mucus throughout the pulmonary and gastrointestinal systems. For an individual to develop CF, they must receive 2 copies of the mutated CFTR gene from their parents. Recessive carriers of this gene are more likely to develop cystic fibrosis adjacent illnesses in their lifetime. So all this means that cystic fibrosis is a chronic, life-limiting disease for which there is no cure, and improving Jacob's quality of life should be at the forefront of the treatments team's mind. A person with CF will have mucus with a higher organic solid concentration than those without. This is linked to a defective cystic fibrosis transmembrane conductor regulator gene. The CTFR generates a protein which controls the secretion of mucus in the lungs, gut, and pancreas ducts. Dysregulation of this system contributes to airway complications such as chronic inflammation, bacterial infections, and decreased lung function. Also, it creates decreased mucociliary clearance, epithelial dysfunction, chronic cough, and can also lead to infections. Within cystic fibrosis, there are 7 different categories of CFTR mutations, each with their own genetic causation and impact on how the proteins behave in the body. The most common being class 2 and delta 508 mutation. The delta 508 dysfunction alters how the endoplasmic reticulum of the CTFR protein behave throughout the body. More specifically, delta F508 is the deletion of the amino acid phenylalanine from the position 508. So what does this mutation cause? The delta 508 mutation causes decreased folding and function of the epithelial cells which move mucus in the airway. The increased mucus concentration is an issue because it is comprised of harmful bacteria or pathogens that need to be expelled from the body. This is compounded due to CTFR dysregulation, which causes hyperabsorption of water from the mucus layer, making it more rigid and hard to expel. The presence of thick mucus in the airway also creates an acidic environment. Furthermore, CFTR cells in the gastrointestinal tract cannot effectively absorb nutrients from food due to bicarbonate secretion malfunction. Other impacts that are experienced in the gastrointestinal tract include reduced bile production and decreased pancreatic enzymes, which increase the pH and fat content of stool. One of the major clinical indicators of deterioration for this disease is the forced expiratory volume decline, which is measured with spirometry, and reduced forced expiratory volume indicates a decline in lung function. This decline is linked to chronic infections in the pulmonary system, which is associated with a low quality of life. Moving on to pharmacology, Trifactor is a combination of 3 medications, which is Exactcaftor, Trezocaftor, and Ivactor. These medications are transmembrane conductance regulators, which corrects and potentiates the CTFR gene that's dysfunctional in cystic fibrosis. So the mechanism of action for this medication. The CTFR channel is responsible for movement of chlorine in the exocrine glands and epithelial sodium. It also regulates the homeostasis of mucociliary clearance. Ivactor decreases the chlorine ion movement to bypass gating mutations found in CF, whereas Tezovactor binds to the delta 508 molecule to bring mature CFTR to the cell surface, improving the function of the mutated gene. So for this medication to be indicated, the person must be diagnosed with at least 1 delta 508 gene mutation, and Research also indicates that this is beneficial for pediatric patients. So some nursing considerations for this medication. So common side effects include neuropsychiatric adverse effects, upper respiratory tract infections, rashes, and elevated liver enzymes. For Jacob specifically, nurses who treat him should conduct skin assessments and look for the papular rash, which may occur during the drug therapy. And several patients who begin this form of medication experience worsening mood and suicidality, where previously there have been none of these concerns. So conducting frequent NSEs is important for these patients. Thanks for listening to my presentation about cystic fibrosis and Jacob specifically. The next 2 slides are just my references. Thank you.